Hello, my name is Dr. Bernali Bhattacharya. I'm a consultant pediatrician, and the lungs of the asthmatic children at our practice is the heart of the practice. Today, I'm going to tell you something really, really important, and that is the correct technique of using the inhaler and spacer. Technique is a very important part of asthma treatment because we do a referral asthma practice. Time and again, we see that children who are not responding to treatment and are referred are actually doing the technique wrong. We are so fastidious that when we do our own follow-ups of our children who belong to our practice, first thing we check their technique. Even during this COVID times when I'm doing a lot of video consultation of the asthmatics who are stable and not getting them out of their homes or to the clinic, before I start the video consultation, I text them and I say that keep the devices and everything ready. And just like your routine visit to the clinic, I would first want to see the technique. So let's go on with the technique. When we say an inhaler, this is the meter dose inhaler. It has a cover. This should always be covered like this, otherwise the nozzle inside might get blocked. So the first step is shaking. Why do we need to shake this? Well, because this canister, when you are using a reliever drug or an inhaled corticosteroid drug, the drug that is prescribed by your doctor is actually only 1 ml of this canister. The rest is other stuff like the propellant, preservative, surfactant, and the medicine sits right on top, and there is layering effect after that, and most of it is the propellant. So if you don't shake it, by shaking you're mixing well. If you don't do it, then a breathless child given a reliever inhaler will have no response because no medicine is going, only the propellant is going. Or if your doctor has initiated the child on an inhaled corticosteroids and has told you about the shaking, but you are forgetting to do it or you don't think it's such an important step, then when he says after 6 weeks there should be some response and there is no response, and everybody is thinking now what is wrong with this child, it's only because something very simple but a very vital step is missed. The second is, after you've shaken, we need to fix it. Now we have to fix it here. Don't try and struggle and fix it here. This is the mouthpiece. This is where the slot for the inhaler. And then the child breathes out. Okay? By breathing out, it is emptying the lungs. They're very good at it. They do it and then they keep wanting to do it. It's like a game. So, and after this you actuate, and a bigger child more than 5 years of age would be taking it deep in and holding for 10 seconds. We hold for 10 seconds because asthma is a disease of the lower airways, and if we hold our breath, the drug by gravitational sedimentation goes into these lower airways and it is effective. So it is okay. Now, why is the spacer important? You might say, well, my child is now very smart. He's 7 years of age. No. Even an adult, even if I need an inhaler, I would be using the spacer. The spacer has multiple purposes. The drug comes out at 100 kilometers per hour. It is very difficult to coordinate the hand, breath, lung. And sometimes because it's coming so fast, you can have a reflex cough. So this is a holding chamber. It slows it down. It's the propellant that does that job. The propellant drops off gradually and then the medicine goes in. If you take it straight on, most of it, 80% of it deposits into our mouth and very less is then going in, and we have side effects too from the drugs. And this is, if you hold it in your hand and check it, it's cold. That's called the cold freon effect. And that itself can irritate the back of the throat. So remember that any time we use the inhaler, we should be using the spacer. Now, I said for children more than 5 years, we can do this single breath technique. For children who are less than that, say 3.5 to 5, we would be telling them that they breathe normally. They can take 6 breaths, and if they are even smaller and their breaths are not strong enough, they can take up to anything to 30 seconds to a minute. I tell all my parents a minute, and hoping that they do it for a minute, and even if they compromise, it wouldn't be less than 30 seconds for sure. So for the younger ones, that is, say maybe from 3 to 5 years, it would be like this. So if they can expel the air out good enough, so the bigger or the stronger ones can go for about 6 breaths, or you can do it for any time between 30 seconds to a minute. Now, why am I saying 3 and 3.5 years old and above, and more than that 5 years, I said the single breath? Because younger than that, we would need the mask. But that I'm going to tell you in another video. So today we taught you to do the spacer and MDI use correctly. Remember the steps again: shaking it, fixing it, breathing out, taking a breath, holding the breath. And for the smaller ones, maybe same thing: shaking, breathing out, and then taking a normal breath for anything between 30 seconds to 1 minute. All right, so please use your MDI and spacer correctly. The technique that we've shown is the technique that you should be doing, and that will bring about great control of the asthmatic. Bye, and thank you so much for hearing me.